My name is Emily Sedlak, and for my 8th grade scenario project, I decided to do my presentation on common sports-related injuries and some physical therapy you can do to either prevent or recover from these injuries. So the purpose of this scenario was to give myself a bit of an opportunity to explore a career in physical therapy, but also, being an athlete myself, to give myself a bit of knowledge behind some injuries. So physical therapy is a great way to recover or to prevent an injury. This video should help to teach a few exercises and provide some knowledge of how certain injuries occur throughout your body. These are obviously not going to be every single injury in the world, but just the most common ones for each area of your body. Starting off in the foot, the first common injury mostly found in young and active people is Achilles tendonitis. This injury normally occurs because of overuse and degeneration, or if you were to increase or intensify an exercise routine really quickly. Achilles tendonitis causes the tendon to become inflamed, causing a sharp pain on the back of your leg. There are two different types of tendonitis, which are non-insertional and insertional. Non-insertional tendonitis is when the middle of the tendon breaks down, causing the leg and heel to swell. The second type of tendonitis is insertional, which is when the tendon attaches to the back of the heel bone. This is the one that's going to occur in inactive people. The main symptoms of Achilles tendonitis are pain, irritation, or swelling of the tendon. The best thing to initially recover from this injury is rest, but after it recovers, physical therapy is a great way to build back the strength in the tendon. Calf stretches, bilateral heel drops, and single leg heel drops are great for easing back into the use of the tendon. Here in the demo, you see the calf stretch on top and the heel drops, which are single leg in this picture, but this exercise can be performed with both legs at once for the bilateral heel drops. Moving on to the ankle, the most common injury is an ankle sprain. This is when the ankle is forced from the natural position and the ligaments surrounding the ankle are torn or stretched. There are two different types of sprains, which are inversion and eversion sprains. Inversion sprains are most common, and it's when the foot is twisted inward and causes damage to the outer ligaments. Eversion sprains are the opposite, which is where the foot is twisted outward, and it causes more severe damage to the inner ligaments. Some physical therapy things that you can do for the ankle to build back the strength are tissue or towel crunches, heel raises, and elastic band pushes and pulls. The top left photo here shows heel raises, which can be performed as a single leg action or with both, as shown here. The bottom right photo shows the elastic band push and pull. The most common injury in the leg, specifically your knee, is an ACL or anterior cruciate ligament tear. This is caused by a sudden change in direction or a pivot against a locked knee, or when the tibia is pushed forward in relation to the femur. This is most commonly found in athletes in sports like football, soccer, or gymnastics. This causes pain and swelling of the knee. Women are more prone to an ACL tear because of differences in anatomy and muscle functionality. The intercondylar notch is also narrower, causing it to pinch and weaken the ACL. Women have a wider pelvis, which causes the femur to meet the tibia at a greater angle, which increases the force that the ACL has to withstand any twisting motion. Muscles in women are also more elastic, which decreases the amount of protection, and their hamstrings react and contract just a millisecond slower than a male, which increases the risk of a torn ACL and a landing from a jump. Some exercises you can do for a torn ACL to rebuild the strength are supine hamstring stretches, ankle pumps, towel stretches, and heel slides. Here you see in the top left the heel slides, and in the bottom right you see the supine hamstring stretch. The most common hip injury is a labral tear, which is caused by repetitive stress and impact on the hip, ball, and socket joint. So most tears occur in hockey and soccer players as well as long-distance runners. This can result from a hip impingement, muscle tightness or weakness, having improper technique when performing an activity, and distance running or repetitive twisting and cutting. This typically causes aching in the hips, a painful clicking with hip movement, a feeling as if something is blocked whenever you move, and stiffness. The best thing to recover from this after surgery is to stretch and strengthen. So you can do things like foam roll, lateral and monster walks with a resistance band, single leg deadlifts, and dead bugs. Here you see dead bugs in the bottom left and a lateral band walk in the top right. That can be performed with any size resistance band, whatever you want to use. The most common issue in your back is to have chronic back pain. So this is pain in your back that lasts over 3 months. It is typically age-related, but can also come from a prior injury. Arthritis and spinal stenosis, which is the narrowing of the spinal canal, which leads to nerve pain, are common causes. So some things that you can do to help this are to retrain your posture, like sitting up straighter when you're sitting in a chair, no slouching, doing some stretching and flexibility exercises, and lots of core strengthening exercises such as planks. These things are preventative measures. So here you can see a proper formed plank, which if you have incorrect form, you can actually cause the pain, not necessarily heal it. And you see plank hip twists, which once again, you want to do it in the correct form. Moving on to the shoulder, a very common injury is a rotator cuff tear. So the rotator cuff is a group of 4 muscles and their tendons responsible for keeping the shoulder joint stable. This often gets torn due to repeated overuse. It causes severe pain and a decrease in the ability to use your arm. There are 2 different kinds of thicknesses in the tear. So a full thickness tear is when the tear extends from top to bottom of the rotator cuff, and a partial tear is exactly what it sounds like. It affects only a portion of the rotator cuff. An acute tear occurs suddenly due to some sort of trauma, such as a fall directly on your shoulder, and a chronic tear develops slowly due to overuse. Exercises you can do to rebuild the strength are doorway stretches, side lying external rotation, high to low rows, reverse flies, and lawnmower pulls with a resistance band. Here you see the high to low pull, rows and the lawnmower pulls. The last injury is a super common one in the neck, which is whiplash. So this is the forceful, rapid back and forth movement of the neck. Sports accidents and rear-ended car accidents are commonly what causes this. So you will experience neck pain and stiffness. Moving will cause extreme pain, loss of range in motion, headaches, and other symptoms such as fatigue, dizziness, and blurred vision in your eyes, of course. Some things you can do to prevent this, not necessarily recover from this, are chin tucks, side-to-side head rotations, side bending, and prone cobra to just strengthen the muscles in your neck. Here you see the side-to-side head rotations and prone cobra, which you want to hold both of these for a couple seconds, 10 times to get the best effects. Thank you for watching, and drop any questions or comments down below, and I will make sure to go through and answer everything. Have a great night.